may ini-enter pa. Hindi ko na kayo enter mamaya kapag nagsimula na ako. More, wala na. Wala nang papasok.
Doc, good afternoon po. Si John Ricklin po ito. Bali kasama ko po si Miss Jaylee po ngayon. Kaya kami po ni Satur tsaka si Ardel po. Bali, hindi po kasi
Isang
kami
form.
makapasok sa meet po. Kaya dito na lang po kami sa ano niya.
Di naman kayo nagpa-add. Anyway, tawag dito. Okay, sige. Just sign the attendance. Okay, meron naman ako dito attendance sheet dito sa labas later na I will give it to you if you haven't, if you cannot able to attendance online. So I have the attendance here.
Okay po, Doc. Thank you po.
Okay, sige. Punta niyo ako sa office later. Okay, so we will continue our discussion. So last time we discussed on the additional on the examination of the heart, at the same time the important or silent points. Okay, with regards to different clinical examination. So I believe I had give you review assignments that will be included in your examination. Nasaan na ba? Okay, wala dito. Anyway, so I give you assignment last time now, so that will be included. I think those are the body condition score and the distant examinations, how you're going to conduct that. Anyway, those are all in the those states. Okay, so later, no, I include that in the reference so that you will just read on that as supplement to this presentation. Okay, so now we are in the diagnostic procedure. So we have done in the clinical examination and its importance, especially in the identification of diseases. Now, we mentioned about the ways. Okay, so kasi the final objective that we would like to aim is to name or to know what causes the disease. Yan. So always remember that in a veterinary clinical diagnostic approach, no, the most important is to accurately, conduct the clinical examinations as well as the investigations of the possible cause of the disease. Ayan. And of course, that will follow how you manage now the treatment, the control, of such conditions. Okay, so let's go. Okay, so just to review, so what is a disease versus disorder? So since this is applicable into ruminant medicine, so if we talk about disease, so you already know about this one. So anything, an interruption, cessations of a physiologic activity of the body, whether in a systems or organ, that could be manifested or sometimes it could be non-manifested if it is a subclinical one. However, the animal still affected with such cause of disease, especially if it is caused by pathogens. That's why the example here is pathogens, those biological causes of diseases, either bacterial, viral, protozoan, fungal, and parasitic diseases. Okay, now for the disorder, this is more of a disturbance of function. So more of non-pathogenic, and it could be affecting structure or both, yan, resulting from failure of activities of the animal. Okay, so some factors that could lead to this are exogenous factors like poison, traumas, etc., especially nutrition. Those metabolic causes of diseases may be included, as factors that can cause disorders to the animal. Oh, by the way, I will be uploading, the topic that you will do, no, in your individual. Marami kayo. I will just see to it if it is a group or an individual presentation of diseases, in the next days after the midterm. Okay, so I will let you know. So I will just post that, the topics that you will be discussing in the class. Ayan, so that is the differentiation between a disorder and a disease. So typically, for us to understand whether we use the word disorder or the disease, but both of these can cause abnormalities, especially in the production, since we are talking about food animals, the productions, activities, okay, of our animals, especially ruminants. Yan. Now, in the making of diagnosis, uh, we all know that in the practice of clinical veterinary medicine, okay, has this important facets. Kasi a diagnosis is, as we all know, the identification of disease affecting the patient. Okay, and in your lower years or in your paraclinical courses, you have already applied some of the diagnostic techniques and how you identify or describe a certain conditions, okay, that the animal is suffering. Ayan. So, the major facets of a clinical veterinary medicine is to make a diagnosis and the provision of treatment and control measures. I always tell you about that. Kasi an effective preventive measures and control measures depends on how you done, okay, the diagnostic side. Okay, so in your pathology, so you learn some of the different types of diagnosis, different nature of diagnosis based on the objectives. So morphological, etiologic, definitive, tentative, etc. So that depends on your objective. But syempre, we would like to know the primary cause, whether it is caused by a pathogens or non-pathogenic, for us to understand and control or prevent the possibility of entry again, the recurrence again, or okay, the continuity, okay, of that abnormalities to the animal or to the group of animals. So since we talk about herd, okay, so there are three parts of making a diagnosis. Ayan, so the first one is to, this is general, no? So the first one is to be specific. Okay, so in making a diagnosis, we would like to get the specific cause, okay, the specific cause of the disease. Sorry, hindi ako makakapag ano, nandito ako sa ano, baka maglalag. Okay, and of course, the next one is the abnormality of structure function produced by the causative agents, which is non-productive or non-parang, it can cause problem, okay, in the normal body processes. So in this diagnosis, no, specificity of the cause should be known, and then how you describe the abnormality of the structure function produced by these agents. Okay, and of course its manifestation. So these are parts of the diagnosis that which you should take into consideration. Ayan. So if you know this, all these three parts, no, ito kasi yung pinaka-salient points in making a diagnosis, then of course you can devise, okay, an effective, okay, management to this, depending on the course or depending on the nature, okay, of the disease process or the sources of that particular conditions. Yeah. And what more important here is that you have a records, okay, in jotting down or in collecting, okay, the possibilities of reasons why the causations or why the disease occurs, and of course the problems that you identified, okay, while the animal is manifesting the disease, or not to uh, parang yung subclinical side, okay, by means of the history taken from the animal. So all of those important should be recorded kasi that records will help you a lot, okay, in identifying what procedure you will done in the future, okay, in terms of more deeper diagnosis and diagnostic tests that you will need, okay, or ancillary tests that you will need, okay, just to predict or to give the ultimate cause of the possible disease. Okay, so what else? So these methods. Okay, so we have here, according to Radostitz, no, so we have 5 methods, okay, which can be used in following a diagnostic procedure or diagnostic examination. So these methods are very complex, no, from a simple to a complex, okay, methods in making a diagnosis. Just remember that the general rule in making diagnosis that experienced clinician uses more of the simpler strategies, the novice clinician more of the complex one. So, wag nyo namang sisihin. So, don't feel sad if you still have no wide, okay, knowing about some of the specificities of some conditions, because as you go by and expose yourselves into the world, okay, particularly in some of those conditions, okay, outside the universities, that's why you have your internship and externship, then you will gain knowledge about this one. Okay, so from a simple clinician to a novice clinicians, then by that you can choose, you can be flexible, okay, in doing better diagnosis, okay, together with some these experts, okay, with you, like the veterinarians in the field. Okay, so we have five here. We have the syndrome of pattern recognition. We have also the hypothetical deductive reasoning. We have the arborizations or algorithm method. The fourth one is the key abnormality method, and of course, the database method. So we have individual discussions of these recognizable methods. Okay, let's take, for example, the first one. Okay, these are the descriptions under the syndrome of pattern recognition. So this recognition is based on the comparison of the subject case from previous cases in the clinician's memory. So napakasimple. The only thing here is that if the clinicians or you do not have any idea of this, that's why you are learning from basic to paraclinical and of course in a clinical case. Because with those paraclinical courses or those basic courses, that will help you a lot. This will give you a reference, okay, in having your clinical eye. So I'm always telling you that. And of course, with that clinical eye, it will help you a lot in making your educated guess or educated decisions afterwards. Okay, so in the syndrome pattern recognitions, if you always have this opportunity to be exposed similarly on that case, or sabi natin paulit-ulit, you are experiencing the same cases and you have that good recording. Okay, if that is blueprint or in actual recording, or if you could remember, okay, that will help you a lot in the recognition of conditions. So it will give you an idea what could be the possibilities that the animal is suffering from. So may mga diseases, there are some diseases that once you had a glance once, and then the second time having the same or similar manifestation, then you will have a tentative or suspected cause. So that is how this syndrome of pattern recognition wants to tell you. So the one is recognized as a replica of the other. So similarities. Okay, so there is no need to seek advice and the definitive diagnosis is made there and then. If some of the diagnosis or some of the or if these conditions tells you the anong tawag mo dito? Pathognomonic signs. Okay, sa pathognomonic sign or just say in the field-based assessment mo, sumasabog siya. So it's telling you that this is the case. Okay, that's why one of our example here is mastitis. The only thing that mastitis should be identified kasi in to make it more complex, no, what could be the there are a lot of factors causing mastitis pa. There are always causations about mastitis. In the syndrome pattern recognition, since you have an idea to that, at least you can do first aid, okay, to make it to relieve, okay, that particular conditions. Kasi in the field, no, especially if we talk about food animals, dapat mabilisan tayo dito. Yun yung one of the differences when it comes to small animal naman. Although sa small animal, we have emergencies, no, but in terms of the treatment, ayan, at saka yung approach mo, yan. So that's different approach with the small and in large animals, no. Dito, antayin ka ng kliyente mo. Ayan, so para mabilisan ng konti. Ayan. So, some details sometimes are forgotten. Okay, parang meron tayong the into details sometimes, no, in terms of the diagnosis in the field ay medyo na ano natin na take for granted because we need to be more parang simpler. Okay, gaya ng sinabi ko, you should know how to talk to your clients in layman's term. Okay, so in the purpose of discussion, so the first one, the method is yon, pattern recognition. So with this activity, no, with these methods of recognition, then at least the client will have an idea. And then, of course, as a clinician, okay, you know what to do, at least first aid, okay, if you recognize this kind of conditions. Ayan. So, in the hands of the wise experienced clinician, the method is quick and accurate. Okay, so sabi ko nga, do not feel sad. Okay, okay, if you don't really that confident. Okay, and charging what possible condition is that you still have time to be to improve. Okay, your educational guest. Okay, kaya nga, you supplement yourselves with readings kasi hindi nawawala yan. Still, the readings will help you a lot as a reference. And of course, it's exposure. Okay, your exposure to the field. Okay, particularly with different conditions. Do not try to parang evade this kind of condition kasi baka mamaya, hindi ko alam eh, ayoko nga. Natatakot ako because I don't know what to say, I don't know how to recognize. No, embrace that. Okay, kasi you can ask questions, you can read okay about this one, and of course I think you know how to say if it is abnormal or normal. In that way you can still have time, you can still have this area, okay, to look for. At least you know that it is abnormal already. The thing is that you don't know whether to how to recognize a normal and abnormal conditions. Yun ang problema natin. Okay, kaya nga, in that way, you need to be familiar, okay, with the abnormal and normal physiology and anatomy of a certain animal. So an example here is mastitis, just like this one. So if you see something like this, definitely, okay, you can think of mastitis. Okay, so you're having an inflammatory or inflame, and you consider my heat, my ang tawag dito? Pain. Seems like the animal is in pain because of this inflamed or swelled conditions of the other. So that means you have an idea that the animal is suffering from mastitis. Now, if you want to go more in detail, syempre, you can do other confirmations to the diagnosis, okay, to that recognized conditions of the animal. But in these conditions, no, you might give a certain first aid to this animal. You can treat. Okay, so habang ginagawa mo yun, kasi yun ang gusto ng client. As much as the client want to expect a good treatment procedure or management procedure to kanyang animal, then mas patok ka sa kanya. Okay, so that is one of the idea, okay, in the methods of diagnosis that you can really recognize, okay, patterns like this one. Okay, so next is hypothetical-deductive reasoning. So we have this deductive reasoning na. And if you have heard me before, I always ask you about this one, lalo na kapag morphological diagnosis tayo, you know how to reduce. Okay, you know how to deduce. Okay, those things that feeling nyo is not an actual that has no actual involvement to the case. Ayan, so you are more focused on the possibilities, okay, especially on the initial clues that you can see in that animal. Okay, so in the hypothetical deductive reasoning, this generates multiple plausible hypotheses. So it means that you are not only dwelling to only one, okay, so hindi ka to bias, hindi lang iisa, no? You can check or you can give other possibilities that can cause that kind of condition. Or let's say, so gawin natin more complex yung mastitis natin. Okay, mastitis. You want to know how this mastitis occurs in that animal. So what could be the possibilities or other causations? So the causation now could be one of those plausible hypotheses. Like for example, heavy yung pag-milk sa kanya. Okay, the milking procedures. The animal have been exposed to traumatic conditions. Okay, aside from that, the hygiene. So there are a lot of possible causations. Okay, that could be a hypothesis or reasonable hypothesis. Okay, from that can be acquired from that particular conditions. Now, for you to deduce those particular possibilities of hypothesis, then you do questioning. You do, dito niya ipasok yung mga history. Okay, acquisitions of clinical histories and conduct of examinations, clinical or your physical examinations. So that will give you and identify the most hypothesis, okay, na kailangan or supporting the condition. So all of those hypotheses that you feel hindi sila, then tanggalin mo na. So it will give you parang direct now kasi you do something to justify, okay, the conditions that you want to um, parang understand or you want to prove. Yan. So, the question examinations may be directed at supporting the tentative diagnosis. So, the confirm exclude technique, that's the technique, but may lead to addition of more hypothesis and deletion of some others. So, sabihin natin, okay, hindi pala hygiene, pero bakit nagkaganito siya? And the others, you can ask also if this is, especially if it is in a herd, bakit siya lang meron? So, there are hypotheses again. So, in that way, no, you might able to look for uh, more. At the same time, you deduce the initial one. Okay, but take note, no, if you are trying to get a history, no, try to look more of those direct. Okay, first, yung mga direct na feeling mo, yun yung pinaka-common. But anyway, or anyhow, you check the environment, the animal, and of course, the management. Okay, if we are talking about the mastitis. So, there are a lot of activities to be done, no? Okay, just to give you a precise diagnosis. So under hypothetical deductive reasoning, you have your hypothesis to prove. Okay, and proving is to ask questions or to interview the owner or those handler, okay, of the herd. Okay, so another one of the important characteristic of this strategy is the independence on the selection of a critical key or cue on which to base the original hypothesis. So I mentioned that one. Kung ano yung una mong nakita. So you base your hypothesis first on that. Okay, so if the hypothesis is proven already, nakita mo that during the milking process ay masyadong aggressive at nakita mo meron siya mga sugat. So most probably the animal got, okay, the mastitic conditions from the traumatic, okay, way of how they milk the animal. And then syempre, napansin mo din na hindi ka ganun, hindi the area where the animal, okay, let's say, or prior to milking, the hygiene is not that strict. So that's the possibility of also entry of possible microorganisms, especially those meron na doon sa area or doon sa, it's more of the microflora. Yan, po posible yan. Okay, but definitely, no, you should know what are the possible microorganisms, okay, expected in a mastitis. Yan, yun. Dapat yun yung isa sa mga framework ng utak mo. So you have a basic idea. Okay, kasi if you're going to ask questions knowing nothing about it, then hindi mo siya ma-identify. You might be going on a wide river na hindi mo alam kung ano yung kukunin mo or kung ano yung what do you call this one? You perfect yung isda na kukunin mo, something like that. Okay, it's very wide. Okay, so you better have also your plan in mind, okay, in doing your deductive reasoning. Okay, so this is done by instinctively by experienced clinicians on the basis of prior experience in similar situations. So another example naman dito is the bloat. Okay, so hypothetical deductive reasoning also. So let's say the problem that is being given to you or the client, okay, yung parang problem na sinabi sa'yo is sudden death. Okay, and then you go to the area, you found this one, you found these two animals, or you found this kind of death. Okay, so the example was bloat, right? Now, if nasabi sa'yo, kasi you have an idea how bloat is, and then kumain, ganito, nakita mo may sudden death. Ang sabi yung Dok, namatay po yung baboy ko, yesterday may animal died, or this morning my animal died. Nakita ko patay na siya. May bloating na. So parang may gas na yung so bloated na yung abdomen. So, yun. Doon sa area na yan, syempre, baka bloated po. Ano po kinain? So, there is this possibility that having the idea to that, alam mo na yung direkta mong itatanong. But definitely, in your hypothetical deductive reasoning, you have the papasok yun ng mga differentials. So depending on the situations that you do during the clinical examinations or the history taking. Kasi sometimes your memory from that conditions may not be reliable anymore to the clinical, okay, conditions after you see the animal. That's why you have now your other hypothesis to that. So in this picture, what do you think? What could be the possible hypothesis that you can come up to? Okay, just to know the cause of the disease. Mga tentative nyo or differentials nyo in these two picture. Anyone? Bibigyan ko nga kayong ganyang exam. Yes, sino yun? Pacifico? Tama ba? Was that Pacifico?
Yes, Doc.
Okay, yes, Mr. Pacifico. What do you think of these two pictures? Do they manifest different possible cause knowing that these animal were found dead in the morning? What could be your possible hypothesis to the death, the cause of death?
Hindi ba bloat, Doc, yung in
Yung isa
question?
kanina is example of bloat, di ba? Okay. So you have your idea, bloat. So do you think if sinabi sa'yo, I was the client that I told you that namatay po, lumawo po yun. Lumawo po yung chan. Let's say, yung may-ari ay may idea about bloat. Baka po bloat. O di, meron ka na. O then, pinakita sa'yo yan, pinicturan. Like for example, pinicturan mo muna, di ka muna pumunta doon, pinicturan. So the first one in the left, ayan. So, are you also believe that this is bloat? Or let's say, the right side naman, do you believe that this is bloat alone? Or is this bloat caused by bloat? Will you stick to your hypothesis as bloat?
Hindi, Doc.
Hindi. O what could be the possible hypothesis from this sudden death?
Marami, Doc, eh.
Sabi
Kasi,
sa
Doc,
sobrang namang dami, di ba? Okay.
parang ang na-observe ko is
Dali lang po mga
dun
kapatid.
sa,
Okay, you will be helped by Mr. Agustin and then followed by Mr. Losada. Okay, sige. Let's hear from
yung,
Mr. Pacifico muna.
sa left side kasi, Doc, based dun sa nakikita kong picture is meron siyang goat yan, Doc, di ba?
Ano kang goat? Ang laki-laking cattle yung nakikita ko. Goat? Di
Ay,
mo ako
sorry, Doc. Hindi ko masyado makita.
Ay,
Cattle
ganun
pala.
ba? Sorry. It's a cattle.
Cattle. So, ang based dun kasi sa picture, meron siyang access sa muddy pond.
Okay.
And based din dun sa mga grasses na malapit sa
Okay.
kanya, possible na nag-cause to ng frothy bloat. Yung too much nitrogen sa ano. Kasi parang yung grass, para silang mga bagong tubo. And yun, isa sa ano ko yun, yung mataas yung ano. However, dun sa right na image, ano yun, yung violet ba yun, Doc? Parang nag-cause ng scar. Hindi ko
Scar.
masyado makita.
Naka-cellphone ka lang ba? Hello?
Payat na nung cattle.
Ay, ako ba yung choppy? Hindi ko yata kayo marinig. Yes?
Hello?
Hello? Ayan, narinig kita. Ano yun? Sorry Hindi kita narinig. Meron choppy. Hindi ko alam kung akong choppy or ikaw ang choppy. Okay, so
Ano, Doc?
yung
Yung
left
nakikita,
side, ay yung right side, ano naman yung possible hypothesis mo sa cause of death?
based
Your,
dun kasi sa hitsura, Doc, nung ano, payat na siya eh. So,
Payat.
hindi lang siya acute na yung kinamatay niya. Although may bloat din, pero parang hindi lang yun, Doc, yung cause eh. Kasi based talaga dun sa end. Ano ba yun, Doc? Violet ba yan, Doc? Hindi ko kasi masyado makita eh.
It's more of like the exudates or the excretions na nakita mo dyan?
Yung excretion, Doc, at saka yung exudate. Parang blue kasi,
Hindi.
Doc, sa akin eh. Hindi ko
Blue
masyado
ba?
makita.
It's more of
Blue.
like an old, it's like a blood. Okay, it's actually a blood.
Blood yan.
It's a dark blood. Okay, it's an old blood or dark blood. Dark blood. Oozing blood. Okay,
Oh,
so
Doc.
ano, yeah. Okay, so I
Hindi
get the
na,
idea. Sige, sige. Go on.
hindi siya, hindi siya, Doc, basta bloat lang yung kinamatay nung nasa left. Ay, right. Oh, yung white na cattle, yung nasa right. Doc. Kasi, based doon sa ano niya, Doc, sa body scoring na, medyo parang matagal nang mayroon tong ano, um, may problem, possible may nagkaroon na siya ng hemorrhagic stools. Yan. Uh, ayun nga, Doc, parang
Okay.
hindi lang siya bloat, Doc, yung cause.
Okay, sige, sige. Okay, so thank you for that, Mr. Ano. Okay, let me hear from Louis J. You recognize?
Hi, Doc. Ano po,
Yes,
Doc?
hi, good afternoon. O, di ano pa,
Talaga.
yung nasa left side mo na.
Doc, I think ang una kong iisipin sa left side, since malapit siya sa river, is nalunod.
Okay.
Tapos yung sa right side, Doc, is hemorrhagic. Meron siyang hemorrhages both sa
Sorry.
nose, I think sa nose to, tapos sa anus. So,
Okay.
ang una kong isipin dyan is anthrax.
Okay. Sige, sige. So, your form of decisions came from.
Doc,
So the
came
first
from dun
one
sa...
is because the environment, kasi
Yes,
nandun
Doc.
siya sa may river, and then
Yes, Doc.
nakita sudden death, it could be possibly one of your hypotheses. So that's one, that's the hypothesis you want to prove. Okay, and then the other one, you saw that there are bloody from blood oozing from the anus and from the mouth. So your hypothesis that the animal might die from an infectious conditions called anthrax. Anthrax. Tama? Yun yung gusto mong i-prove naman.
Yes, Doc.
Okay. Sige, thank you for that. What about Mr. Losada?
Doc, for me,
Yes,
para
you're
sa akin
recognized.
po, Doc, since yung positioning po ng body niya, Doc, is
Wait lang,
stiff.
sabihin muna kung sa saang picture.
Yan po, Doc, may arrow
Left.
na red. Right po ba
Okay,
yan?
okay, dito right muna tayo. Okay, sige, go.
Parang
Right.
Doc, sa base po lang, Doc, sa positioning, tapos parang may muscle stiffness siya.
Mhm.
Is Doc, is tetanus.
Okay.
Tetanus, Doc.
Okay, and then what about the other one?
Yung sa kabila naman po, Doc, is Doc, both kasi, Doc, ang tingin ko tetanus kasi yung naka-arc yung back niya, tapos stiff yung muscles.
Okay.
Pati, Doc, yung parang yung jaw din, Doc, nung first image is rigid din.
Okay. Okay. So, yun lang, Mr. Lozada?
Yes po, Doc.
Okay, so wala nang hahabol ng observations with the two pictures?
Ano, kuya mo?
Oh. Wala na. Okay. So thank you for that now. What did you observe? So those three students, your three classmates, no, have mentioned how many diseases, how many conditions. So someone, Mr. Pacifico mentioned about bloat. Okay, bloat. The other one, ano yung isa dito? Ano yung sinabi mo dito sa ano kanina? Ano pangalan nito? Pacifico dito sa right? Bloat din.
Parang nagkaroon ng hemorrhagic scoring, Doc.
Ayun. So, scarring. Okay, sige. You have the scarring. Okay. Thank you for that. Then, Louis J. mentioned about drowning. Okay. So, namatay yung, based on the observation. Same with Mr. Pacifico na he counted the conditions because of the environment presence where the animal died. And same with Mr. Luigi, sabi niya kasi malapit siya sa tubig, so possibly that the animal drowned, no, for a certain some time, then nalunod siya for the death. And for the for the right part naman, because of anthrax, because of the oozing of this dark blood from the animal. Okay, and the last one, Mr. Losada mentioned about tetanus. Now, you have actually, those are the possible, yun yung conditions, okay? If you are the one proving for your hypothesis, you have three hypotheses to prove. Now, that may give you an idea now, okay, during your other, tawag dito, your other steps, okay, to prove for this hypothesis. So I leave you to that, no? With this kind of photos, you can actually give different hypotheses to that. And I love it because you don't have the same hypothesis. Okay, ibig sabihin, maybe siguro may hypothesis kayo doon, but in that means, no, pwede kayong tumingin sa different conditions. And with that different conditions, you can draw, you can research on this one, proving, okay, the cause of that sudden death. Okay, that's very good. Kaya kasi titignan ko on how you going to dig on the possible reasons of the sudden death. Okay, so thank you for that. Kasi hindi ko sasabihin muna, hindi natin alam kung ano talagang kinamatay. Hindi mali, hindi din naman tama kasi nandun pa rin tayo sa hypothesis. You can only get your final diagnosis through, okay, going in detail of the other conditions or omitting the other conditions not related to that particular. So anong gagawin mo? You have your history taken at the same time, okay, your other clinical examinations. This is just a few pictures here. But knowing that you have an idea to this, ibig sabihin you have your reference in mind, your basic understanding in a certain study that when this kind of photo or documentations was given to you. Okay, so thank you for those students. Okay, next. That's the hypothetical, no? You can prove the three. So these three problems here, you can prove this, that one of these may be the cause, okay, of the problem. You know, the case of these two, I tell you, the case of the left side is a true case of bloat. Okay, and then that is, I got this one from a case. Okay, so case presentation, kompleto yon. So bloat up photo niya from a client. And the other one is an anthrax. Okay, so because of the oozing blood, okay, bloody weight is unclotted. So yun yung nakalagay sa case. That's why may may photo. This is a real case. Okay, real cases to. O, di ba? So having your hypothesis to this one give you a lot aggressiveness to know more of the case. So I hope when you do that in your field work, do that, okay? Kasi critical thinking yon. Okay, so wag kayong matakot, okay, to explore, okay, the thing that you feel na you want to prove, okay, about. Kasi with that, no, you can challenge yourself. Ayan. Kung gaano kagaling ka, not kagaling, but kung paano mo ipoprove yung isang condition to. Because this is one of the skills, okay, that we wanted you to develop, okay, as day one competency. Okay. So what else? Now, the next method is the arborizations or algorithm method. So this approach a listed series of diagnoses and examines each one in turn within supporting or disproving questions. If they pass the proving test, they stay in. If they fail, they are deleted. Now, if you will notice, no, it's more like a hypothetical deductive reasoning, only that it is more of expanded form. So, gaya ng sinabi ko, from the simpler to a complex method of identifying the possible cause of the disease. So, in the arborism, medyo mas complex na yung series of proving the hypothesis or proving the cause, okay, of that disease or cause of that condition. Kasi you are now testing because you have your parang parameters, okay, to check, parameters to follow, okay, whether the condition satisfy these parameters or not. So provided that the list of all possible diagnoses is complete and is frequently updated as new diagnoses become available, and just as importantly as new ways of supporting or discontinuing each hypothesis are added as soon as they are published, the method works well. Ibig sabihin, there are previous, okay, there are previous conditions like this and have it recorded and published, Okay, so meron tayong actual reference to this one. Okay, it's a formal reference to this one. Okay, and with this, no, so once you experience that feeling was similar, then you compare. So there's a comparison to this one. Then in that way, no, you have the list to that. Kung yun ay tawag dito, parallel. Okay. So the descriptions parallel to the or similar to the conditions that you want to prove, then maybe it could be the same. If not, then it could be not. Okay, so that is how the algorithm method, you have the parameters. Okay, so you have the parameters to do this one. So the thing is that that parameter should be reliably recorded. Yan. So there's a system. Okay, kasi dito, pati yung system of tests, okay, or diagnosis was or are included. Okay, supporting for the possibility that this is the cause of the disease. So that's the algorithm method. So like for example, ayan, so this one. So the conditions given to you is that the animal is having hematuria. Yan, because of the bloody urine. O, tignan nyo to. Okay, may bloody urine. So that's the problem. So you want to know more whether it is a hematuria alone or may hemoglobinuria. Because in some instances, there are some diseases that the animal is may hematuria, but definitely there's no hemoglobinuria. Because you want to check whether it is caused by another disease or just an implications of an underlying causes of hemolysis. Right? So, with the recorded conditions or recorded cases supporting these conditions, yun yung magiging use mo as a parameter. Trying to prove whether it is a hemoglobinuria or an hematuria from a certain conditions. So yun, madididos mo siya. Okay? And in the same way, in that record, maybe they also had a treatment plan or management plan before and naging successful, then definitely you can approach that measure. Then if that became positive to the reset or the current conditions, then possibly it's similar already. Okay, that's the algorithm method. Okay, so another photo. So this is a picture of a condition showing you a very sticky exudates from the nose. Okay, yung iba nagiging ano na siya? Ano yun? Yung thickened. Okay, discharges, and the other one causes diarrhea. Okay, so showing you these manifestations, you might think of simple conditions like respiratory problem. However, may diarrhea tayo. Okay, so it could be a pathogenic or non-pathogenic, infectious or non-infectious. But definitely, if you see this one, mas marami siguro to think that this is caused by infectious conditions. Only that, how infectious is that? So there are a lot of possible differentials that you can draw with this kind of manifestations. But what you see here is that you need to categorize, okay, the different manifestations like this one. And if this is within the herd, let's say they have thickened or heavy exudate, or sorry, heavy nasal discharge na tumitigas, and then same, the animal is also diarrheic. What could be those recorded, okay, conditions that could have a similar, okay, manifestations like this one? This picture, I got this one from a research that this disease is ruminant. Yes, this is ruminant. Ano tawag dito? Yung Pesidipetis ruminans. Yan. So this is one of the manifestations in goats. Okay. So if those, kasi dun sa degree of diseases or degree of conditions ng Pesidipetis ruminans, diarrhea is also considered. Diarrhea is also manifested. And in hemorrhagic septicemia, you cannot see diarrhea at all. Okay, those are some of your differentials. Or in a typical respiratory CBPP, you cannot see, okay, diarrhea to there. Okay, or involvement of diarrhea on that case. So those are some of your deductive reasoning. So since you have the record to that, no, you can compare your observations, okay, from the record, okay, of your clinical Okay, yung differentials mo. Baka tanong nyo, Doc, saan kami titingin ng record? Siyempre, you may know the record if you have your differentials first. You look for you establish your differentials and then you look for the record from this one and then compare. Okay, so that's it. Okay, and then the fourth one is the key abnormality method. Okay, this is one of the best for me, although it's very tasking. So the key abnormality method is a time-consuming method requires the clinicians to rely on their own knowledge of normal structure or function to select the key abnormality or clinical cue. In short, ito na yung understanding on the anatomy, physiology, okay, and the pathology applications. Your paraclinical, your basic sciences, and your clinical, okay, skills, okay, in determining the cause of conditions. So the guiding principles to this is that all functions of the organ under examination should be observed and any abnormalities are noted. So this is how you are doing during our general pathology when you do the necropsy. So all of those changes that you find, you put that in records because those records will tell you descriptively or morphologically the animal is suffering from certain conditions. Okay, so there are steps. Okay, so these are steps of the abnormality method. The first one is determination of the abnormality of function present. So physiological manifestation, ano ba yung function present? Ano ba yung may abnormality sa functioning of the body? Okay, next, determination of the system or body as a whole or organ affected. Okay, next is determination of the location of the lesion with the system or organ affected. Okay, so location is very important, no? Kasi some lesions cannot only be found in one area. If a certain conditions like systemic cause or suspected systemic disease is the culprit of the condition. So you might find other lesions other than the respiratory, maybe the other portions of the body can be seen. Determination of the type of lesions, whether it is inflammatory, non-inflammatory, or what we call mga space occupying. Yan. So that kind of lesions. And of course, determination of the specific cause of the lesions. So the last one, cause of the lesions. Okay, so the accuracy in diagnosis means increased efficiency. This is the final criteria that you will need, okay, in understanding disease process. And that is your key, okay, to have a successful veterinary practice. Accuracy in the diagnosis. Okay, so I got this one sa kay Radostis, so you can read more of this one kasi it is part of your exam, no? Makikita nyo doon. And most of the inclusions of these presentations came from that book. Okay, so the key abnormality method, ito na yung 5. So we have the first one, yung abnormality of the function present. So the general physical examination, you can check, okay, through a physical examinations. So detections of clinically significant abnormalities. Ayan, which will lead to determining the probability of abnormalities in a certain function of the body. Like for example, may problem siya sa gait. Okay, ano yung check mo? Ulo? Anong system? Musculoskeletal, nervous system. Could be one. Okay, yun yung mga check mo sa manifestations. Kasi based on the manifestations, you can have a target. Okay, yung first target mo to check. Diarrhea, anong tatargetin mo? Okay, so gaya ng sinabi ko, you should be aware on the common manifestations that the animal is presenting. Yung mga common signs. I think in your small animal medicine, no, there are common signs that have been presented to you that it will lead you to a certain differential diagnosis. And this is the same in large animal. Step 2, examination of suspect systems or organs. Now, during general physical examinations, there's a problem in the gait. So you check for the musculoskeletal muscle, whether the animal has lameness or something like nervous problem. Then, in the step 2, you check, may problema ba? Okay, doon sa kanyang musculoskeletal problem. And to know that more is that you can check, you can get samples. Okay, for laboratory or for physical activities naman, you check for the movement. Recumbent na siya, hindi na ba siya makakatayo? So those are just problems in terms of the physical examinations that it could lead you to a more ways to identify, okay, the suspect systems or organs affected. Okay, so ito yan. Determining system organ involved. And then the third one is special examination of identified system. So kung hindi enough, okay, yung una, you might need to explore other means to identify a specialized system. Okay, so you might use radiography, endoscopy, especially in problems in the kidney, heart, kasi hindi naman open yung internal. Okay, so it could be one of the methods on how you identify, determine the locations of a particular lesions. Kasi di mo makikita yan. Okay, by just, you might have an idea because when you do the laboratory, there are increase in the enzymes. So ibig sabihin may mga necrosis na nangyayari that could reflect to the liberations of enzymes, okay, in the blood. But definitely you can check for ancillary tests to help you identify the exact locations of the lesions. Okay, step 4, yeah, determines the type. Now, you know the exact, and then you see a lesions, you see a mass. Now, you check whether what type of mass, whether inflammatory or non-inflammatory, just space occupying. Okay, those are some of the entities that you need to understand. Okay, and the last one is examinations of a specimen that could specifically determine the cause of the lesion. Okay, so that's how it is, no? To be done in the key abnormality method. Ito yung dapat nyo, actually ito yung as a clinician, no, ito yung dapat yung alamin. Okay, from this is a systematic way, okay, in the diagnosis also. Kasi you will look into it in details. Parang nag-necropsy ka from systemic, okay, from a ante-mortem, or let's say prior to the examination, prior to the opening of the body, you do the physical examinations just to validate, okay, the clinical history. And then afterwards, you do the in toto postmortem examinations. But prior to holding everything, okay, every systemic is that you do the display stage to see whether there are changes in the positioning or some of the fluids, etc. So these are systematic also. This is a systematic way, okay, in the key abnormality method of diagnosis. Kasi you see the abnormalities. And the last one is the database method. Okay, from simple to semi-simple or semi-complex to a very complex, okay, method of diagnosis. However, in the database kasi you have the term database. There you have a record. You have a pool, okay, of proof, okay, or support to a possible identified conditions. So sabi dito is also called the with or problem-oriented method. So parang it is more of a CPC, a case-to-case, okay, parang clinical pathological examinations. You do all the possible ways to identify, to support your hypothesis and everything. So ito na yung parang from method 1 to method 4. Then in the database method is a complete one, okay, in which you can assess now, okay, the cause of the possible condition. Okay, sabi nga dito, this is an excellent system for the teaching of clinical veterinary medicine, in which you seek signs or syndromes labeled with diagnosis and select best fit with the patient's data. So recording again is very important here. Okay, what else? Okay, so this is an expanded version of the hypothetical deductive hypothesis, okay, which made sequentially, okay, especially if informations are available. So all the hypotheses are pursued in parallel because of all the data have been collected into the patient's database. Example, a conditions fatty filtrations of the liver, you check whether this fatty infiltration of the liver is an inflammatory cause or non-inflammatory cause, okay, conditions. So there you have your parang records, okay, to prove the cause of fatty infiltration. So your fatty infiltration is just a degenerative, but it could be caused by a greater underlying cause. Yeah, so however, now the source of error in this method is the possibility of undue importance being attached to the child's abnormality. In short, because this is a database method, nandiyan yung clinical history, laboratory exams, etc. Nandun na lahat. Masyadong massive information. Okay, napakaraming information that some of the inclusions may not be parang not so needed but directly. Minsan indirectly na siya. Okay, doon sa cause. So let's see, like for example, wala pa yata akong example dito. Okay, so yung like for example, the diarrhea. Okay, diarrhea is given to you as one of the presenting cause. Yan. So ngayon, dun sa presenting cause na yan, um, meron kang mga may respiratory or let's say may skin diseases, but during your recording, no, some of which are not truly parang helping you a lot. Okay, kasi dahil sa diverse, okay, photo or picture ng conditions. Kaya nga, always remember that early detection is the best pagdating dito. Okay. Ang masama dito, marami kang tuloy ngayon titingnan because of the database method. Okay. Ang key dito is that you first or elicit the most clinical signs again. Same. Parang you follow how the methods happen in the key problem. Okay, yung key problem, hypothetical deductive method. Okay, so ganun lang yung gagawin for a systematic reading on that particular method. So it takes a lot of experience and exposure to that para you know what to omit, okay, in the database method, kung ano yung source of error to that. Okay, that could lead to parang unclear, interpretation, okay, of the conditions. Ayan. Kasi ang titignan mo is the diarrhea, or not diarrhea kasi masyadong broad yun. You prove that the animal is may Ehrlichia, ganyan. And then lumabas bakit meron siyang problem sa pagdating sa clinical biochemistry, may mga lumalabas na tests na feeling mo hindi siya directly. So yung gusto mo lang i-prove ay may Ehrlichia siya kasi sumasabog na yun ang tumitingin, but definitely in some instances may changes din sa ibang biochemistry niya. O yun, dumating tuloy that it can give you idea that the animal is not only suffering from that, but what you need to prove first is the main clinical conditions. So yun yung some of the instances when it comes to the database method. Kasi kompleto na, marami na kang makikita dyan. So chances are another hypothesis and a hypothesis and a hypothesis. So the key there is just go first on the main primary conditions that the animal is suffering from para meron kang magawang preventive measures. And then if there are some changes, then that is some of the recording ancillary may mga extensions, okay, possible observations, okay, sa possible progressions to that. So yun, dun muna siya anong tawag mo dito? If a follow, okay, you follow now any changes from that result that you get from or that you got from a clinical biochemistry. Yan. So yun, di mo itatapon, but definitely you still have, you should be aware that there's some result came out from the primary, okay, conditions that you want to prove. Yun lang yun. Okay, so in the database method, we have also the problem-oriented veterinary medical record system. Ito yun. So most of the elements in the database method based on the problem-oriented veterinary medical record system. And that composed of the database, problem list, initial plans, and the progress notes. Okay, in the progress notes, ito yung sinasabi ko kanina, no? That in the progress note, it is completely described into, ayan, for you to understand more of the progress notes, it should include the subjective info, ayan. And then of course, you have also the objective datas, the assessment of the problems, and of course, the plans. Ayan. So yung plans nyo, whether you can include other diagnostic procedure or prove the diagnostic procedure that you conducted. Okay, ito ay more to a parallel therapeutic, kung yun ay effective or not. Yan. So ito na yung mga susundan mo. Or this will also help you to give a client education. Okay, doon sa progress note ng animal. So sometimes this database method is quite non-reliable, suitable for use in animal medicine. Kasi nga, what we need here is mabilisan. Yan, for use. especially in food animal medicine. Yan. So, nabanggit ko na kanina na dapat in the field, lalo na pag mga food animals natin should be mabilis. Okay. Okay, so the diagnostic procedure is more of an examination to identify an individual's specific areas of weakness and to determine a condition's disease or illness. So, just to prove that in certain examinations or medical examinations, okay, you need to have this understanding, okay, for you to get the exact cause of the disease. And to know that or to get that, no, you need the principles of the clinical and laboratory. So I've mentioned this. It's already incorporated in our previous discussions. However, just to give you an idea again, okay, in the clinical diagnosis, basis in the medical science, reported symptoms or the diagnostic tests. And for laboratory, nandun yung term na laboratory, you use diagnostic techniques, especially the laboratory techniques, okay, which determines, okay, yung mga other instances that is supporting, okay, the tentative diagnosis that you want to prove. Ayan, so ito yung mga subtypes ng diagnostic procedure. Okay, so reasons in the laboratory data interpretations, just to confirm the presence or cause of a disease. Ayan, so assess the severity of a disease. Excuse me. So with that also, you can predict the clinical course of a disease or determine the progression. Kaya nga palaging sinasabi, no, you have a good record, okay? Then with that, no, you can follow, okay, the progressions of the disease. This can also estimate the response to therapy and determine whether the therapy, okay, is effective or not. And that also lead to the satisfaction of requirements, particularly the regulatory requirements. Since we are talking about food animals, we have protocols here. And determine the disease or immune status of animal, herd, flock, okay, animal, individual, or a group. Okay? So the decision, okay, so yung decision mo of diagnosis, so this is a very important aspect to that. Okay? Interpretations of the data that taken from the laboratory. Yeah. So although these are ancillary activities, no, but they possess a great impact to the interpretation or the diagnosis of a particular conditions. Okay? So, ulitin ko, this is in coordination also of the clinical history, ayan, and physical examination. Kasi yun yung napag-usapan natin in the clinical examinations. We have the three aspects, okay, in the diagnosis or examinations of conditions. Okay, so in using the diagnostic test, so always remember to have an early, okay, detections, okay, of infectious diseases. So why? This is to diagnose and improve the effectiveness of treatment and avoid complications. So underdiagnosed patients or undiagnosed especially, undiagnosed patients can unknowingly transmit the disease to others, especially those subclinical. That's why in the early stages, no, we have mga different diagnostic tests, okay, to screen. Okay, kanina doon sa mga presentations na mga proposals, we have this screen technique or screen test to know whether the animal is having the disease. So with that, you can prevent or control the possible spread. Okay, so widespread overuse and misuse of antibiotics contribute to antibiotic resistance. So if you do a routine screening of disease, no, of the animal, especially if it is infectious, then you can provide the basis of a specific treatment. Ayan. Kasi in your pharmacology, remember your pharma 2. We have what we call broad spectrum antibiotics at saka narrow spectrum. Better if you give the narrow spectrum one because it only kills the specific bacteria. That is to avoid also the attacking or the affecting of other bacteria. Ayan. So kaya lang yung margin of tawag dito? I forgot the term. Okay, ng treatment mo, yan, dun lang magkaka-problem kasi in the narrow one, medyo high, kaya pwedeng mag-cause ng side effect. Okay, so there is a the probability of side effect, yung sa, ano yung term yun? Help me, nawala ako. Yung margin of safety yon, sorry, margin of error nasa isip ko. The margin of safety in the narrow spectrum is very little. Okay? So that unlike in the broad spectrum, meron yung narrow of safety niya is medyo mas maluwang. Okay? So the probability of having side effects is lesser than in that narrow. But in terms of the direct cause to a specific conditions, mas okay sanang narrow. Okay, provided that you know what pathogens cause the disease para ma-lessen mo yung possible antibiotic resistance. Okay? So always remember that you do only diagnostic tests or the tests, okay, should be performed if you anticipate a productive result. Do not let the client do the diagnostic test para lang gusto mong makita kung may posible and you don't know whether this will be helpful or not. If you suspect that there's a certain thing that you can see to that, then you go to a diagnostic test. Remember, some diagnostic tests are mahal and some are not accessible in some areas, no? Okay, so yun lang yung dapat natin intindihin. The cost, okay, and the availability to that. Okay? And of course, it should have a helpful parang note in the interpretation of the possible disease. Okay, so this is the function of diagnostic tech, confirm or rule out conditions and diseases. So note, a test should never be performed. Nakakasabi ko na to. One can anticipate all the likely results and provide a meaningful interpretation for each. Okay, so a good proper diagnostic test. So we have these properties. So the first one, the test should be developed and validated in the population of interest. So all of those diagnostic tests that have been, thank you, in the market now, prior to be marketed in the market, it underwent a lot of clinical trials. Okay, that is for the validations. Kaya nga, if you remember, some of you presented their proposals, tinatanong namin yung validity, specificity, etc., accuracy of your test is that to know whether this is applicable to this kind of conditions or to this kind of disease at this sample. Kasi it might vary. Okay, if that happens, no, that will affect the possible interpretation of the conditions. Okay, that's the validity in a populations. Baka mamaya hindi pwede it could only be in an individual. It cannot be pooled sample. Okay, so those are some of the instances that you need to consider. Okay, para makuha mo yung best test and result from that diagnostic test. Accuracy of the test. So the accuracy, you take note of those possible factors that affects the accuracy of the test. Like situation, when, or kailan mo ba siya gagamitin? Will it be okay to get the sample and make the test there and then? Or it needed an environment for you to go before or prior to conduct the test or to use the diagnostic tests. So those are some of the consideration. You should know the accuracy of the test, whether it is very sensitive to a certain environment or the test itself, okay, is accurate enough, okay, to give you a desirable result. The specificity of the test. It was mentioned a while ago in the proposal discussion. Ay, kakalabasan ko. Sorry, hindi ako pwede dun eh. Maingay ako dun. Okay, it was mentioned a while ago in the proposal discussions, what is that variable being asked in the specificity and in the sensitivity. So actually, the specificity, that gives you a true negative. So ruling out the positive. Okay, so it rules out the ability of a positive result. And same, yung counterpart naman is the sensitivity of the, because it tells you the true positive naman, the sensitivity, ruling out the negative. Okay, so that's how, and in your epidemiology, it was discussed, and it has what we call formula. That is to give you the specificity and sensitivity of a certain test. Kasi in some instances, when you talk about routine or yung mga screening tests, they are more of the sensitivity. So parang what you get is positive that the animal is positive with the disease, having the disease. Okay, eliminating the likely of negativity. But if you are truly for confirmatory diagnosis, you are more of the specificity, the increased chances of the disease, the increased chances of the animal having none of that specific target of conditions. That's the confirmatory diagnosis or the specificity test. Okay? So during my during my training doon sa transboundary disease, may nag-questions about the UCA kasi sa screening test most of the time mas mataas yung sensitivity, it could lead to 100%, 90% than the specificity kasi nga more of the screening test siya. So dapat positive talaga having the disease itself, yun yung matitest, especially if it is subclinical. Okay. Pero sabi ng isa, in states or in the other advanced countries, okay, sa mga developed countries na, they are trying to promote both 100% specificity and 100% sensitivity. So parang they're working on a test, something like that, no, that could prove both high specificity and high sensitivity. Yan. So sa Pilipinas, we are trying to delineate pa, okay? Or we're trying still to cope up pa with that kind of accuracy or precision. Yun, precision of a particular sensitive or diagnostic test. Okay, another, know the pretest likelihood of the disease in the population. So ito yung binabanggit na true negative at saka yung true positive. Yan. Yan yung sinasabing no, the pretest likelihood. Okay, and that actually ano tawag ito? False positive and false negative pala yun. The false positive and false negative, yun palang likelihood ng ratio, yun sa NPV at saka yung PPV. Yan. And all of those are incorporated in ano ba to? Determining the accuracy and precision of a diagnostic test. And that, hindi ko na i-discuss isa-isa yun because that's all in the epidemiology. Okay? So, basta always remember that if you are trying to make a diagnostic test, you need to consider all this accuracy, specificity, sensitivity, the likelihood of test results in the populations, in the disease populations, and the reliability or repeatability, okay, of those tests. Ibig sabihin, if you check this in this group of animal, okay, in the same area, dapat you get the same result. That's the repeatability. And reliability, kung gagawitin mo yan sa iba area, okay, you can gain the same or similar results. That's the reliability and repeatability of the test. So if you have that properties, then you can have a good characteristic of diagnostic test. Okay, also, in the properties of diagnostic test, you may able to know the meaning of abnormal test result. Okay, so kaya nga meron kang rerunning, okay, of the test or confirming that test. Kasi you know how to depict whether it is abnormal or not. So you should know the possible factors affecting the test. That's why in the presentation a while ago, the proposal, I asked whether ano yung possible conditions that could affect in the reliability, okay, of testing that particular sample. Okay? So another, the test should allow you to rule in, rule out the differential diagnosis. Syempre, that's why you do the diagnostic test because you want to confirm something. Okay? Kung hindi mo confirm, huwag ka na gumamit. Walang silbi yung diagnostic test. Okay? And of course, all the tests should be interpretable. So that is the properties of diagnostic test and it will help you a lot, okay, in the diagnosis of a condition. So this is, okay ito. So I got this from Rado Stitz. Yan, so makikita nyo doon. Ito yung sensitivity, accuracy, specificity, the false positive and false negative, the likelihood in ratio sa NPV and PPV. Okay, so lahat yan, napaka importante, the positive predictive value in the populations, likelihood in the false positive and false negative, and of course, the sensitivity and specificity of a certain condition in a diagnostic test result. Okay? So, these are some of the examples of diagnostic techniques. So, you have still here the gold standard. So, I think doon sa mga nag-report kanina proposal, no, because they will going to use mga test or diagnostic test. Well, those are, kaya nga na-question kanina, if these are the gold standard. Ma'am, ako na pong bahala magsarado. Opo. Gold standard. Okay. So, ano ba yung mga gold standard to be used? Okay. So, most of the time, you have the PCR, sabi na, as one of the gold standard. Isolation identification agent. Hybridization. DNA hybridization is one of the gold standard also. But that depends on the conditions. Kasi in some references, doing the necropsy can give you a gold standard to a certain conditions. Lalo na kapag may pathognomonic signs. So nga, what we just want to exclude is the possibility, or to deduce is the possibility of multifactorial diseases. Yan. Okay, so yung lamp kanina, ito nakita nyo yung mga yan. Okay, so I don't know if you can see my pointer, no? So these are some of the present or current diagnostic techniques in the field. Okay? So, ito yung I think mababasa nyo ba? But you can find this one sa Rado States. I just put this one because it summarize, okay, the possibility of examination of a herd. Okay? So, ito yung kanyang ayan. So, you have the definition of the abnormality using the subtypes, no? Whether it is a clinical or subclinical. You do the different tests to this one. This is the examination of the herd, no? So clinical, comparison standards of clinical normality. Sa subclinical, since you cannot see whether the animal is manifesting or not, then you need to take in considerations other tests, okay, to check whether the animal is having the disease or not. Then with that, you could now define the pattern of occurrence on the field. So since this is examination in the herd. So you check its correlation to time, the nutrition status as factors, the genetics that the animal have. These are predisposing factors. Okay, and if that is clear now, you can categorize the abnormalities, whether it is caused by infectious causes, nutritional. So ito na yung abnormalities ba whether it is a disorder or caused by infectious diseases. Okay, so kapag na-identify mo na, and you want to be more clear, specific, okay, yung causative dito, then you do other. Okay, defining the cause of abnormalities in the herd through confirmatory examinations. At the same time, is response to a management, okay, treatment. Yan. So, if that all coincided, ibig sabihin, you identified the cause of the disease. Okay? So I guess that ends our discussions for this one. Hanggang dito yung exams nyo. So from the very beginning up to this one, together with the reading assignments that I've give you last time. So ito yung reading assignments nyo, no? For the examining herd, you can read more of the page 31 to 37 by Rado States, or include all. Okay? The clinical examination, make and diagnose by Rado States in the 3 to 37 pages. Okay? So yun yung dun sa examination coverage nyo. Okay, so any question? Hello, are you still there?
Yes, Doc.
Okay,
Yes,
so
Doc.
narinig nyo ako doon sa sinabi ko?
Yes, Doc.
Yes, Doc.
So I'm going to
Yes,
upload this tonight. Sige, upload ko to tonight para meron na kayong idea with the references to read on. Okay, so if you don't have any questions, so everything should be in balance. So that's homeostasis. That's why we need to know more the cause of this problem is to possible establishing, okay, the new homeostasis to that, which make it more pro live pro-life for the animals. And of course, its impact dun sa society ay hindi naman siya ganun kagrabe. Okay? So, everything should be in balance. So, these are my references. I haven't included here Rado states because that was already in your microsyllabus. These are just the references that I include there as part of the presentations. So with that, no, thank you so much. So if you have questions, you can just chat. So I will give this all 111 slides plus your reading assignments. The preventive, I will also pala, no, I will give also, hindi, sa discussion, i-discuss ko na lang, another quiz na lang yun pagkatapos ng midterm. So your midterm will just cover the ruminant animal, the clinician, the environment, the disease agent, diagnostic procedures, and the diagnostic procedures. So yung mga therapeutic control procedures, that will be a separate exam na lang or quiz or long exams after midterm. Okay? So, did you understand? Did you get something from this discussion? So I hope you are listening. I hope you listen. Okay, so if you don't have any questions, I guess I call it a day. It's already 5. Okay, so kung wala na kayong questions, please do not forget to put your or sign your attendance sheet. Ayan, kasi this will be my reference that nakinig kayo sa akin today. Okay? So with that, thank you very much and good afternoon. See you tomorrow. Yan, kung magkikita-kita tayo.
Thank you po, Doc.
Thank you,
Guys,
Doc.
thank you so much.
Thank you.